Hi, I'm Dr. Tony Mork. I'd like to just review how the week goes when you come to Newport Beach for an evaluation and surgery. On day one, I will see you here personally in the office. Most likely you'll have your paperwork done, and if it's completed, it'll help us to get started a little bit more on time rather than trying to fill it out here. After that, we'll actually see you and examine you, get a good history from you, do a physical examination, and review your MRI films. After we've determined the nature of your problem and what we can do for it, I'll be giving you some prescriptions for pain medications and antibiotics. These can be filled locally or at the pharmacy near the hospital. I'll also be giving you a business card with my personal cell phone on it, so if there's any questions or problems throughout the entire process or post-operatively, you have direct access to me. As mentioned before, if you have a more complicated problem and diagnostics are needed, these will be performed on the afternoon of day one or the morning of the second day. Remember, if you are scheduled for diagnostics, please don't eat for the entire day or drink anything. Don't eat or drink anything, since it may require having a sedative while we're doing this. And last of all, on day number one, have a good dinner, because you may be without eating for a bit on day number two. Day two is your surgery day. So number one, don't eat or drink anything after midnight. Number two, just register at the hospital at the given time and location described on your schedule. Number three, I will come and meet you in pre-op at least 15 or 20 minutes before the scheduled surgery, so that I can just say hello and see if there's any questions that you have to answer. From there, we'll go directly to the operating room. Your friend or family will be in the waiting area, and this is a good time for your friend or family to go pick up the prescriptions that I gave you on the day before. After the surgery, I will go out and talk to friends or family in the waiting area. Remember that when you leave the hospital, it's a good idea to keep your appetite in mind. It's a good idea to eat light. You might be quite hungry, but eating something light like soup or maybe a salad or a shake, maybe a smoothie would be a good thing, nice and light afterward. And as soon as you do get to take something by mouth, be sure to start taking your pain pills and stay ahead of the curve with respect to any post-operative pain that you might experience. It's not a bad idea to use an ice pack for the first post-operative 24 hours, just to reduce any pain and swelling that's local. Also, if there's any small amounts of drainage on the dressing, not to be concerned, because I'll be coming by in the morning to change your dressing. You also have my phone number, so if you have any questions or problems at any point in time, feel free to give me a call. Day three. This is the day after your surgery. Well, first of all, you have a waterproof dressing on, so if you desire to take a shower, no problem there. As soon as you start to get some food in your stomach, and I mean food in addition to any coffee, it's a good idea to start taking your antibiotics as prescribed. The third thing that will happen during the day, probably mid to late morning, I will come by and change and look and inspect the incision dressing, and I will change your dressing for you. And if I'm not there exactly as what you expect and you like to get up and move around, moving around for short distances is just fine. Day four. This is your second post-operative day. Probably just a continuation of yesterday. You're eating more comfortably, taking antibiotics and pain pills as necessary, and you're probably becoming a little bit more active, moving from a sitting to a standing to a laying down position as you feel comfortable. You're free to give me a call with any questions or problems that you might have. You could contemplate leaving on this day, but I would recommend leaving this day as a day of rest, and for leaving purposes, I would leave tomorrow. Day number 5. This is your 3rd day post-op. Hopefully you're feeling quite a bit better by now, and you would be free to go home at this point in time. So at this point, you should be on your way to recovery and on the way home as well. I want to thank you for listening to this. I hope this has been helpful to understand your 4 or 5 days here in Newport Beach in having your surgery and recovering to the point that you can return home comfortably. Thanks.